Thank you for joining us for another episode of PROXUS Perspectives and Business Insights. I'm your host, Matt Roessler, Director of Business Development. As a human capital management technology provider, PROXUS has the good fortune to partner with many of the area's top professionals in employee benefits, human resources, and financial advising, as well as our area's top businesses and nonprofits. With a background in human resources management and consulting, I'm thrilled to have the opportunity to spend time talking with these individuals to bring you impactful perspectives and business insights. Join us periodically as we spend a few minutes diving into different relevant topics. With me today, I have Representative Todd Stevens of the PA House of Representatives. Todd serves the 151st District of Montgomery County, consisting of the townships of Horsham, Lower Gwynedd, Montgomery, and Upper Dublin. Todd is a graduate of Shippensburg University, as well as the Widener University School of Law, and serves on the Children and Youth, Consumer Affairs, Government Oversight, Judiciary, and Transportation Committees. So Todd, first off, I want to welcome you and thank you for not only joining us today, but also for your help in determining that HCM technology and payroll providers like PROXUS, were and should have been considered an essential business at the beginning of the COVID-19 crisis.
Well, thanks so much for having me, Matt. And, certainly for all those folks who continue to work as essential employees being on the front lines, they need to get paid. And we need to make sure that payroll operations and other important support functions continue to remain in place during this pandemic for sure. So I'm happy to help there.
Yeah, very good. And that was kind of our thinking as well. So was there anything that I missed there in that brief intro that you wanted our listeners to know about you that I didn't share?
No, I think that's about it. I've got two small boys. I've got an 8-year-old and a 5-year-old who've been home during this pandemic. So like many families, I certainly understand the stresses of balancing, being a part-time teacher, trying to work and, trying to keep them occupied as well. So I'm sure plenty of folks who are listening to this know those issues all too well.
Yeah, those struggles are certainly real, and we talked as we were getting started here about the webcams, and I've seen more pets and children and all sorts of things come across the webcams here in the presentations and conversations I've been having. And you mentioned the challenges here for everyone, so it certainly goes far beyond just childcare. From a government leadership perspective, what are some of the toughest challenges that you've faced?
Well, it's constantly evolving. And I guess that's one of the probably the biggest challenge is that every day it's a new challenge. During the beginning, at the outset, there were a lot of concerns. We're very focused on our healthcare systems, our hospitals, frontline healthcare workers, making sure they had enough equipment and capacity to handle, what was expected to be a huge influx of patients. Having watched what occurred in Italy, I think many of us were bracing for something similar here. And then when it came to New York, that I think raised our concerns a little bit even higher. Fortunately, that did not come to fruition here in Pennsylvania. And, we've been able to weather that part of the storm. We still have significant strains on our healthcare system. Our hospitals are in serious need now of continued support in terms of equipment and support for their personnel, but they really need financial support as well. We recently were informed that they're seeking about $3 billion in some help through this year's budget process, just to keep the hospitals afloat here in PA through all this. So that's been a real challenge. And then, moving off of the healthcare side and dealing with the business and personal impact that this pandemic has had on employers and employees alike. Our unemployment system has been completely overwhelmed and was not prepared to deal with the influx of those that were seeking unemployment compensation. And then, obviously our businesses, most of them having to be shuttered for long periods of time. Many of them still shuttered, trying to figure out how to make ends meet just to pay the rent or the mortgage. There are some fixed expenses, some fixed costs that these businesses have had to continue to pay despite the fact that they have no revenue coming in. So that's been a challenge, and we continue working through that every day. And it doesn't get any easier because our schools have been closed. As a matter of fact, my son's elementary school was the first one to close in Pennsylvania, a little bit ahead of everybody else because there was a student there who was treated by a doctor who was COVID positive. So they shut the school down. But now families are concerned, and as our school district's concerned about the summer camps that they might operate through July and August, and then what does a return to school look like in September? And that's a question that already many folks are focusing on and trying to deal with, because our schools are going to have to prepare if they need facilities changes, if they need personnel changes, scheduling changes, busing changes. There's a lot of challenges there. So this is keeping us busy for sure. I guess it's a long way to answer your question, but in a nutshell, what's most challenging is how this keeps evolving, and the issues. It's like whack-a-mole, except you don't ever really get that mole down back into the hole. You hit it and you go move on to a different one, but then that other one pops back up again. So, it's been a challenge for sure for everybody.
Mm-hmm. Yeah, and certainly we can emphasize with the school side of things and the camps. I mean, we've got quite a few private schools and school organizations that are clients of ours, and we're definitely trying to support them in every way that we can. Same thing with our summer camp clients. You mentioned in there in your response about the budget with the healthcare settings and the unemployment comp. So what about challenges to come, right? So we know the impact that the shelter-in-place orders had on the national economy. How are things looking for Pennsylvania? Tell us a little bit about the discussions that are being had to support the state budget.
Well, that's been a pretty robust discussion. And, I guess I have to take a step back. Our governor took a pretty aggressive approach at the outset and, shut down, most of the state. He was very aggressive with that. And actually, I think to his credit, some of the reason we did not see the influx of patients in our hospitals and a healthcare system being overwhelmed as they've seen in other parts of the world is because he took such aggressive steps. And when I say aggressive, I mean he shut down businesses that even the CDC wasn't suggesting needed to be shut down. Now that caused a lot of concerns here in Pennsylvania. A lot of businesses felt like they shouldn't have been shuttered when they were, and the House and Senate have been continually pushing back on some of those closures. That we have felt may have been a little bit overkill, I guess is the best way to put it. And I get it. The governor's acting in abundance of caution, trying to keep everybody safe. Now that we've been through the high water mark in cases, many of us are really pushing hard to get our businesses back up and running safely. Those that can do so following CDC guidance and ensuring that they're protecting themselves and their workers and their customers. We'd like to see them back up and running as quickly as possible. So at the last accounting, our Commonwealth was about $2 billion below estimates for the fiscal year. But we're a little bit in the dark. Our fiscal year typically runs July 1st to June 30th. And tax day is April 15th. So normally, May and June is when we in state government are focused pretty intently on the state budget, and we have to have one passed by June 30th. My point is that when we're dealing typically in crafting a budget, we are aware of the tax revenue collections that have come in by April 15th. We delayed our tax day from April to July, following the federal government's lead on that, which leaves us a little bit in the dark in terms of what our revenue picture is going to look like for the upcoming fiscal year. Now, obviously, largely we're dealing, the collections we're seeing now are for income that was earned in 2019. So we don't expect the income tax collections to be hit particularly hard, but we are considerably concerned about our sales tax collections, that would come in typically quarterly for 2020. And so, some of our other taxes that also would be due in 2020 remain a big concern for us. So we're going to have serious fiscal implications and impacts from this entire pandemic, and we're going to have to work hard to try to address them, really prioritizing our spending and focusing on those essential core services that must be delivered. And we're going to work really hard to get that done, and done by June 30th.
Yep. And you keep using the term "we" there, and when I'm out, doing the little bit of shopping that I'm able to do or feel comfortable doing, that we've got the overhead speakers saying, we're all in this together, and it is definitely a collective effort here. From a bipartisan perspective, where do you think both sides of the aisle have really come together well? And then conversely, where do you see opportunities for better collaboration?
It's a great question. I think that it's been a challenge. One of the issues that we've been dealing with is that the emergency powers that our statutes confer upon our governor are fairly broad, and not fairly broad, they're incredibly broad. And I don't know that they were contemplated for a long-term pandemic like this, but we're in a situation right now in Pennsylvania where our governor, because of the state of emergency, has the authority to both enact any law that he pleases and, frankly, suspend any law that he would like to. And the legislature really doesn't have much authority whatsoever to interject. There is a provision that allows us to end the state of emergency, but that requires a resolution in the House and Senate. And our Constitution requires that any resolutions in the House and Senate have to go to the governor for his approval. So, that's a challenge. So, we have tried to have as much input as we can as a legislature, trying to maintain this balance of power. You normally just read about these things in the textbooks, right? And checks and balances and co-equal branches of government. But we are living it now, where we do get edicts, coming down from the governor's office that we had no opportunity to even be heard on before they come down. And I think there's some considerable issues there that are leading to some friction between the executive branch and the legislative branch, I guess is the best way to put it. So to answer your question, I think on healthcare issues, there's widespread agreement that we need to do as much as we can to support our nursing homes and our hospitals. Our hospitals weathered the storm, and now we're dealing with financial fallout. Our nursing homes, I'm not sure if your listeners are aware, but in Pennsylvania, about 70% of the deaths across our state occurred in nursing homes. In my home county, in Montgomery County, it was closer to 80%. So we have a real problem in our nursing homes, and we are fighting really hard to put the resources in place and get the protections in place for our frontline healthcare workers and our residents in nursing homes to really stem that tide, because the numbers are just way out of whack, and we need to really get that under control. So I think that's a place where we've seen considerable agreement and working together. On the issue of business closures is probably where we need to have some more collaboration. The administration has largely gone it alone in that regard. And so unfortunately, I think that's a place where we could really use the benefit of a more collaborative approach.
Okay. Yep. And I know, certainly the nursing homes, and like you said, we've all heard the stories. It's a very vulnerable population. My grandparents, certainly up in North Jersey, same thing in a nursing home that was hit fairly hard by the crisis. And, like you said, the business openings and closures as well. And I would imagine that part of that, is testing, right? So expanded testing. And I've seen several press releases from your office starting back in mid-April related to expanding the testing availability. So talk to us about your efforts with that and any successes or struggles that you've had.
I guess in early April, I became aware of these concerns concerning lack of testing. I have been pushing to have universal testing in our nursing homes for some time, as I said, since the middle of April. Recently, there was a U.S. Senate hearing, and the chair of the committee there said that he believes that testing is the way back to school and the way back to work. And I happen to agree. We've got to have widespread testing. In our Montgomery County Correctional Facility, they tested everybody, every inmate there, and they found that 96% of the positive inmates, the inmates testing positive for COVID-19, were totally asymptomatic. No fever, no cough, no other indication that they were sick. And when you take that and you apply that to other congregate care settings like a nursing home, and you think about the staff that are working, daily in those facilities, and the fact that 96% of those that may be actually carrying the virus could be asymptomatic. Waking up in the morning feeling perfectly fine, no cough, no fever, no other ill feelings, and heading off to work. Yet, bringing that virus into that facility, again, to our most vulnerable population, that's a really great concern for me. So I've been a proponent of widespread universal testing in our nursing homes. And I think, additionally, beyond that, we're going to need widespread testing for anyone who comes in contact with our most vulnerable populations. We've seen the data here in Pennsylvania shows us that, those over 60 are at greatest risk. Those with comorbidities, and pretty common comorbidities, hypertension, diabetes, heart disease, those are the folks who are at increased risk for death as it relates to COVID-19. So anybody who's coming in contact with that population, in my mind, needs to have pretty regular and routine testing in order to ensure that we aren't, unknowingly passing this virus along to those who would be in harm's way.
Mm-hmm. And along those lines, so part of the multiple states reopening plans is the fact, or the idea, that the number of cases needs to level off, right? So flatten the curve. We need to see a leveling off or a dropping in the number of cases. Balance that concern or interest against additional expanded testing, right? Because wouldn't, in theory, if we expand testing, doesn't that cause the number of cases to go up and then delay reopening?
Well, so it may, but look, in the end, we can't put our head in the sand. I'd rather know that a nursing home worker has the virus and ensure that they stay home and don't go into that nursing home, than have the alternate scenario of just, well, we're not going to test because we don't want to know whether we have this many positive cases or not. And that's why I also think it's important to focus on our nursing home population and then ultimately expand that to those who are having contact with our most vulnerable population. There's been a lot of talk about whether nursing home numbers should be excluded from the overall population numbers. I would support that type of an approach, but as I mentioned earlier, the governor's making these decisions unilaterally, and he has rejected that approach. So I think we're stuck with the metrics that the governor has laid out for the time being. I do think because they're isolated in a nursing home, it would be fair to exclude them from the counts in the rest of the county. Frankly, I don't think we should be using county at all as a metric to reopen our economy. I think what we ought to be focused on is how we can protect our most vulnerable individuals. Let's let the data and let's take a data-driven, more strategic approach, protect those that need to be protected, and then let those that can safely return to work, who are not having contact with our most vulnerable folks, get back to work. The virus doesn't stop at a particular county boundary. I think it's just absurd for us to look at it geographically, because that's just now not how we operate. We cross county lines all the time. I grew up on County Line Road, as a matter of fact. And my parents still live there. So, my sister lives across the street in another county, but it doesn't mean that, there is an interaction there. So to think that this virus is going to stop at a county line, it defies logic to me. Everybody says we need to let the virus dictate the timetable of reopening. I think we also need to apply that same logic to how we reopen, because geography is not something the virus respects. But we do know that the virus focuses in on certain populations, as I mentioned, those that are older and those with comorbidities.
Yep. Fair enough. So as we wrap up, wanted to really give you the opportunity to share what you're hearing from your constituents, whether that's individuals or business owners. So anything that comes to top of mind that you want to share with the audience?
I think one of the things that I really would like to share, which may be unusual for, it might not go directly to what your question was intended, but, there seems to be a real lack of civility or decorum that we've devolved into lately. And it's frustrating because, we're all trying to solve these problems. And, whether your a family member is in a nursing home and you're worried about their health, or whether you're a frontline healthcare worker and you're worried about protecting yourself or your family, or whether you're a business owner, who's worried about something that you've saved or worked your whole life to build, or an employee who's been out of work and still has to make a rent payment or a mortgage payment and still put food on the table. Everybody's struggling. I mean, everybody has been impacted by this. And I think that we could all use I think just take a breath as we communicate with each other and as we try to address these issues. Try to put ourselves in other people's shoes, try to consider someone else's perspective and recognize that they might have a different perspective than our own. And if we can be open to other people's ideas and perspectives and walk just a few minutes in their shoes, I think it would go a long way towards helping us all to get through this together, as you mentioned earlier. So I think that's my parting comment that I'd like to share with everybody. To the extent that we can take a deep breath and try to treat each other well and with respect, I think that would be really helpful for everyone involved.
Yep, 100% agree with you on that one. Well, Representative Stevens, listen, I very much appreciate you taking the time and joining me today. Certainly appreciate you sharing your thoughts and perspectives on all of this. The work you and your colleagues are doing is valued by your district and all of Pennsylvania. We've shared your contact information there on the slide. Certainly encourage those in your district to reach out. But otherwise, like I said, really appreciate the time. Stay well, be healthy, and hopefully we'll be talking to you soon.
Sounds great. Thanks so much. I appreciate it.